So I am Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakana, one of the co-founders, and I want to welcome all of our guests. Hopefully we have lots and lots of guests this evening. I want to welcome all of our business partners to the line. And tonight we are going to be talking about our new product line, Love is in the Air. And how appropriate, right? With Valentine's Day right around the corner, we all want to be ready. But let's forget about Valentine's Day. Let's talk about how important our sexual health is, right? Very, very important overall to have a healthy sexual health, a healthy ability to interact with our partner and to really enjoy each other. So let's get started with what I'm going to do every Wednesday for the month of February, Black History Month. I'm going to be dedicating each Wednesday webinar to an African American female or male in medicine. And so tonight, I had the privilege of speaking about Dr. Rebecca Lee Crumpler on our hospital Facebook page. So you can hit Roseland Community Hospital Facebook page on Friday. Every Friday, I will be just showcasing someone in medicine. So Dr. Rebecca Lee Crumpler is really dear to my heart. Why? Because she really had lots and lots of roadblocks for her to become a physician, just like I did, even though it was not in the 19th century, but still today, we still have our struggles. So she was the very first African-American female physician ever in the United States of America. In fact, she was the very first African-American physician author ever in the United States of America. In fact, her books were focused on exactly what I do: maternal child health. How do we improve the health disparities in our community amongst Black women having children? So that's what she was about. She faced a lot of roadblocks, but she was determined to become a physician. She graduated from New England College, which is now part of Boston University, in 1864. So tonight we salute you, Dr. Rebecca Lee Crumpler. So let's talk about sexual health. And you know, when we talk about sexual health or sexual dysfunction, which is the unhealthy part, we have to talk about anxiety, right? Because anxiety really can cause a lot of issues in performance. And so it is something that arises when men are plagued with erectile dysfunction, or women are plagued with a low libido or vaginal dryness. Just the anxiety of knowing that you have to perform sometimes makes these issues even worse. And then let's talk about our heavily medicated society, right? A lot of times, many of us will just resort into, give me a pill for this problem, instead of really looking at the underlying problem and really addressing that. And what happens when we take a lot of pharmaceutical medications? Well, not only are there a lot of side effects, but there are very dangerous medications out there that many men take, i.e. Viagra, for their sexual dysfunction. So most types of sexual dysfunction can be addressed by treating the underlying physical or psychological problems. And I'm going to say this a million times tonight. When we look at sexual dysfunction, when we look at, for instance, a man that has erectile dysfunction, the common denominator that is evident in a lot of these sexual dysfunction disorders is a blood flow issue, right? If blood cannot flow to these very important parts of our body, like our vagina, like our clitoris, like our penis, If blood flow is impeded, cut off, reduced, there is going to be a problem. So we have to improve blood flow, we have to reduce inflammation, and we have to correct any underlying condition that can lead to a sexual dysfunction. We have to improve and correct our anxiety as well, because if anxiety is an issue, that is going to cause a problem as well. So we have treatments, strategies that can address these issues, like medications we're going to talk about, mechanical aids, sex therapy, behavioral treatments, psychotherapy, education, and communication. So how is sexual dysfunction diagnosed? Well, it's not really hard, right? I mean, you know when you have a problem with a sexual relationship. So many times you don't need to have someone diagnose you. You make your own diagnosis, and typically you seek out a consultation. You seek out help. When you address this with your physician, and every physician should, during your annual exam, ask you if there's any sexual dysfunction, sexual issues with the libido, with having an orgasm, with getting an erection. All of these things should be assessed during an annual exam. They're going to do a complete history, a complete physical, and blood work, because many times diabetes, hypertension, high cholesterol, coronary artery disease, a lot of these chronic long-term conditions can be the reason for sexual dysfunctions. And a lot of the sexual dysfunction may present first, and then a diagnosis of diabetes or hypertension is diagnosed second. Another thing that they'll evaluate is your attitude about sex. You know, doing a good sexual history. Have you ever been abused? Was there any sexual trauma in the past? Are there relationship concerns with your spouse? Is there medications that we can look at tweaking, reducing, omitting because they're causing these sexual dysfunction? Is there alcohol or drug abuse that can cause these sexual dysfunctions as well? So whenever you look at the underlying pathology, the underlying culprit of sexual dysfunction, you have to rule out any medical conditions. First thing. So let's look at some of the treatments that may be offered to you by your physician. You know, women, we don't have a lot that's offered to us. You know, men, they have a long, long list of medications that can be used. But another thing that women are going to have to make sure that there are no hormone deficiencies, right? Men can have hormone deficiencies as well. Low testosterone is a real big reason why men's libidos are reduced. But when it comes to men and erectile dysfunction, I'm going to say it 100 times, it is a blood flow issue. We've got to improve the blood flow to the penis, to the arterial supply, so that an erection can occur. And that can only occur when we reduce the inflammation in those blood vessels, if we reduce the plaque, arterial plaque, and build up in those blood vessels to improve erectile dysfunction. Let's look at women. Women may be going through menopause or perimenopause. Their estrogen may be low. Women can have low testosterone as well. So we have to also do a very good and detailed blood and laboratory workup to ensure that those hormones are at adequate levels. So hormones can be replaced, right? You can take estrogen or estrogen and progesterone. You can take testosterone. Men can take Viagra. But again, our whole goal is to improve and to increase blood flow. Also, women have medications and drugs that they can take, like Addie, in perimenopausal women, to help to improve vaginal lubrication, to help improve the sensation of the clitoris and the stimuli that is needed to have an orgasm. So all of these medications are great, but what they come with side effects. You know, Viagra comes with a huge side effects of causing in many men heart attacks, and they pass away. And so a lot of these medications, yes, are used short term, but long term, many of our patients are looking for alternatives for their sexual dysfunction. There are mechanical aids as well. There are aids such as vacuum devices that are used, or penile implants to help men who have erectile dysfunction. There is an Eros clitoris stimulating device for women. It is approved for women. It is very, very expensive, but it's there. There's dilators for those women who have a condition called vaginismus, which is a painful contraction of the vagina. Women can't even control this. It's like a muscle spasm in the vaginal area. There's dilators for women who have vaginal narrowing or who have vaginal atrophy. As we get older, estrogen, which is lost during menopause, is very, very important to lubricate the vagina, to lubricate the urethra. That's why so many postmenopausal women have recurrent urinary tract infections. So all of these things can be used mechanically to help improve orgasm, climax, and sexual enjoyment. And then there's education and communication, right? Having an open dialogue with your partner, having some barriers that may be there. Maybe there's some marital stress, or there's issues with infidelity. And so education and communication is really good. And that's really helped and moderated with a sex therapist, a psychotherapy therapies that trained counselors can really help lots of couples to talk through things. There's behavioral treatments that there are lots of techniques that you can use for self-stimulation. So there's other things that we can do outside of medications, outside of mechanical aids, that sex therapists can be very, very useful for. So love is in the air. Love is all over the air. And again, February 14th is coming up very quickly. And tonight we want to talk about how CBD can be an option for those who want to not only spice up their love life, but they have some really concerning issues like erectile dysfunction, like a loss of libido, like vaginal dryness, lack of orgasm. So let's talk about CBD. So let's first look at the plant. Many of our guests on the line may not know what CBD is, so I'm going to spend 2 minutes in really explaining what CBD is. Now, CBD is a compound, or cannabinoid that we call it, that comes from the cannabis plant. Now, there are 2 species that the cannabis plant makes, and those 2 species are marijuana and hemp. And both of these species, as a family over cannabis, contain over 100 compounds. Now, the 2 most common compounds are THC, or delta-9 tetrahydrocannabinol. That's part of the plant that gets you high, that makes you euphoric, paranoid, gives you the munchies, right? And then there's CBD. It's another cannabinoid that the plant makes, but it doesn't get you high. There's no psychoactive component. There's no euphoria, no munchies. And it's called CBD. And CBD is found in high amounts in the hemp plant. So all of the products we're going to talk about tonight are sourced from the hemp plant. That is the species that gives you the health without the high. So we're not going to speak about the marijuana species at all tonight. And although CBD can come from marijuana as well as hemp, we're going to speak about the plant that gives you the health without the high, that has the legal limit of THC, which is 0.3% or less, and will give you an alternative for your sexual health as well. So when we look at CBD, and this is a little blurry, it's important to, let's go back again to the pathology. Let's go back to what's the problem with folks who have sexual dysfunction? What's the problem with men who have erectile dysfunction, or men who have a loss of libido? How about women who have vaginal dryness or loss of libido or inability to have an orgasm? When we think about sexual health, sexual health is a combination of factors of our brain, our central nervous system, our reproductive organs, our hormones, our nerves, our arteries, our muscles. When you think about an orgasm, right? You think about the penis becoming erect. It takes all of that. It takes the brain, a muscle, arteries, nerves, muscles, all of that has to be in order and intact, right? And so we're gonna bring this all together, why that's so important, that you remember that when we talk about sexual dysfunction, we've got to have all these different parts of our body intact, in balance, in homeostasis, right? So CBD has lots and lots of medicinal benefits. But for the purposes tonight, when we talk about sexual health, let's look at what CBD does to help assist in these sexual dysfunctions. Well, CBD reduces inflammation. We talk all the time about how when the blood vessels are inflamed, that causes a lot of dysfunction in our body. CBD also helps to reduce and relieve anxiety. We talk about how sexual dysfunction, when we have sexual anxiety or anxiety to have intercourse for many, many reasons, it can cause issues. So CBD helps to relieve anxiety. It also is a vasorelaxant, which means that CBD helps to open the blood vessels. We talked about how erectile dysfunction is a blood flow issue, right? If we can't get blood flow adequately through the penile arteries, then it's going to be hard for that erection to occur. If we can't get blood flow to the clitoris in a woman, it's going to be hard for that woman to have an orgasm. CBD also reduces the arterial blockage. It reduces the risk of arterial blockage. Why is that important? Again, if the arteries are blocked in your body, it reduces blood flow. Reduction of blood flow is going to have a compromised sexual function in the penis, in the clitoris, in the vagina. So CBD, as it relates to sexual health, we want to really look at its benefits in being a vasorelaxant, opening up those blood vessels, reducing inflammation, reducing arterial blockage, and relieving anxiety. So remember that. And remember, we need all of those parts of our body to be in balance. The brain, the muscles, the nerves, the arteries, all the hormones, right? So CBD works by a science called the endocannabinoid system. And the way it works is that it keeps our body in balance. It's a regulatory system that regulates our hormones. It regulates our endocrine system. It regulates our brain and nervous system. And it does that by binding to receptors all over our body that send signals to areas to cause balance or homeostasis. So yes, even when the hormones are out of balance in men and women, CBD actually helps to assist that. It helps to assist reduction in anxiety by releasing more dopamine and serotonin in the central nervous system. It also helps to reduce muscle spasms. So even in those women that have that very painful condition we talked about, vaginismus, very, very painful muscle spasms of the vagina, it helps to reduce muscle spasms. So now you can see how important CBD is in assisting in not only improving blood flow, reducing anxiety, helping to work on the brain and central nervous system, work on the muscles, and work on the hormones. So this is how CBD and the other cannabinoids work in the body, through the endocannabinoid system, binding to receptors, sending signals, putting the body in balance, and very, very useful in aiding with those who have sexual dysfunction. So let's look at vaping, right? So here at Wakana, we have some amazing smokable products. And what I love about smokable products is that they work fast, right? It's almost like, I don't know. Have you ever heard of a quickie, right? So those are instances where you want to get it in quick and fast, but you want to relieve that stress and anxiety quick and fast. So with vaping, the CBD is able to get into the bloodstream within 1 to 5 minutes. So it's a great, great tool to use to reduce anxiety, sexual anxiety, to help relieve and to really quicken the effects very fast. So we offer here at Wakana, we have cartridges, vape cartridges, our hypnotic, which I love. I love this because it has more of a peppermint sort of flavor, our raspberry jane, our pre-rolls, our premium flower. So we have a CBD joint that you can smoke, or you can buy a premium flower by rolling your own flower, or you can vape our flower. Now this particular product is a product that is a full spectrum product, which means if you have random drug screens at your job, this is not a product you can use, because even though the small amount of THC, which is 0.3% or less, are in our power products, they potentially could show up on your drug screen. But this is a great product to get things started in the bedroom, to relieve anxiety, sexual anxiety within 1 to 5 minutes, and to really relax the body. Now, our new products. This is the exciting thing, because we want to combine all of our existing products with the products that we are launching this evening. So our Honey Love. Our Honey Love is a product for women. It's for our queens. And it is a product that you are going to ingest. It is made of premium honey, royal jelly, panax ginseng, and of course, CBD from cannabis sativa L. This is a product that you want to use. About 1/4 of a teaspoon will give you 6.25 milligrams of CBD. Again, this is another product that's a full spectrum product. It contains 0.3% or less of THC, and it's a great product that you can put in your tea, you can put in your water, you can ingest 1/4 of a teaspoon at a time to give you 6.2 milligrams of CBD. But it's the royal jelly that gives you the anti-inflammatory, the antioxidative properties. Royal jelly has lots of medicinal properties. Even it helps to reduce and to prevent a buildup of plaque. It's the panax ginseng that then gives you that aphrodisiac, that stimulus that you need for boosting your libido. So the combination of the CBD, we've already talked about the benefits of CBD as it relates to sexual health, right? The reduction in anxiety, the anti-inflammatory, the fact that it's a vasal relaxant, the fact that it also helps to reduce plaque, along with the royal jelly and the panax ginseng that gives you that instant stimulus of libido, this is a product that you want to combine with those smokables, right? And these products are meant to be in the system before sexual encounters, right? You want to use these products for wellness, your overall wellness of sexual health. You don't want to use these products just when the interaction is about to happen. And we're going to talk about why that's so important, right? Well, we can't leave out the men, the king of the jungle. KOJ is kings of the jungle. So Honey Love KOJ is for our men. Stress relief, energy, libido. Again, these same ingredients are really, really important to do what? Help improve blood flow. Blood flow is the issue in men and women. We've got to improve that blood flow to those very important reproductive organs like the penis, the clitoris, and the vagina. The Panax ginseng will give that boost of libido that we need and even energy. The cannabis sativa L are 100 milligrams of CBD in that 1 fluid ounce jar. Again, a quarter teaspoon will give you 6.2 milligrams of CBD. A great product you could put in your water, your juice, your tea. But again, it's something that you want to use on a consistent basis, right? We want to make sure that that CBD is working to address the underlying issue. The underlying issues that we've got to reduce the inflammation in those blood vessels. We have to improve the blood flow to those important organs, and we have to reduce that anxiety, right? And then we have our king of the jungle gummies. Now, this is a game changer. Our gummies are 150 milligrams of CBD. This is a full spectrum product with the 0.3% or less of THC. It is a product that you can use at any time. You know, gummies take about 30 to 45 minutes to get into your bloodstream. So this is definitely a product that you're going to want to use at least an hour before a sexual encounter. It's going to address stamina. It's going to address libido. It's going to address performance. It's going to do that with two really key ingredients. The honey goat weeds and the yahombi are two organic products that address, again, improving blood flow, reducing the inflammation, causing the blood vessels to relax, and also with the CBD to help to relieve anxiety. Again, I can't stress enough when we talk about sexual dysfunction, common denominator is inflammation and reduction in blood flow. As long as we are using these organically grown products to do that, and they're in your system, this is what's going to really be in addition to a holistic way of addressing sexual dysfunction. Then we have the Pure Seduction product line. The Pure Seduction product line includes our shave oil. Our shave oil, again, is 100 milligrams of CBD, along with our carrier oil of MCT coconut and lemon oil. This is a great product for our men as they are really protecting their skin. You know, our skin is the largest organ in our body, and CBD has lots of benefits on the skin, reducing the bacterial area and growth that the skin can have that causes acne and a lot of other skin conditions like eczema, psoriasis. It helps to reduce those bumps that a lot of men get. By why? CBD is an anti-inflammatory. So this is a great, very sexy shave oil that men can use. And after, they have an aftershave balm. Again, this is a organic product with 100 milligrams of CBD. This is a topical products. So whenever you are dealing with topical products, they are safe for any of those who have random drug screens at their job. But this is a great way to really be soft, sensual after you shave for your ladies. And then our Pure Seduction G-Spot. This is our CBD lube, 400 milligrams of CBD. Again, topical products do not pass the blood-brain barrier. This is a product to enhance sensation, right? Lots and lots of women have issues with getting an orgasm, having a climax. This will cause the, again, increase in blood flow. It will help to give a better sensation, more sensation around the clitoris. It is a product that you want to use on the outside of the vagina. You don't want to put this all the way in the vagina. You want to put it on the outside. It can act as a lubricant as well as enhancing the sensitivity around the clitoris. When we talk about CBD and all of the other ingredients, again, reducing inflammation, improving blood flow to the clitoris, and being a great, great product to help with sensation, to help with the women who have not only libido issues, but more specifically issues with being stimulated via the clitoris. So what's coming soon? Our CBD body butters with our lotus and hibiscus. Those are coming very soon. Those are products that you do not want to ingest. These are body butters. So you're gonna put these on your body. They've got great, great ingredients, all organic products with 100 milligrams of CBD. Again, with the lotus and hibiscus, aphrodisiacs, really causing that skin to be sensual, causing the skin to be soft. All of these things will help in the bedroom. Now, I want to talk about how important it is to, along with these products, not to forget about our tinctures. Now, our tinctures are what every single person who is dealing with a sexual dysfunction should also be using twice a day. You know, CBD has to be in the system so that it can really work on the underlying issue. Sexual dysfunction, improving blood flow, reducing inflammation, reducing anxiety. So our tinctures, we have our power line, our pure line. Our power line is our full spectrum line. You want to use these products twice a day. Our pure line is our broad spectrum line. That's the line for those who have random drug screens and want to use twice a day. But I can't stress enough that most people who have sexual dysfunction, most people are diabetic, they are hypertensive, they have some underlying condition that is causing a reduction in blood flow. They may have high cholesterol, they may have some plaques, coronary artery disease. These are conditions that causes a lot of sexual dysfunction. So you want to address that. You want to have lifestyle modifications, your diet, your exercise, you know, your tinctures, your smokables, your honeybees, your gummies, our new gummies, your G-Spot CBD lube, the shaving oil. All of these things should be used together, and they should be used daily, right? When we're talking about long-term conditions, we've got to really work on addressing these issues and not just 30 minutes before having a sexual encounter. These are issues that need to be addressed every single day. So I highly recommend that you use our tinctures twice a day, 3 drops under the tongue, twice a day, either our Power 500 milligrams, or we have one that's 750 milligrams. If you have a more challenging event going on, we have a water-soluble product where you can put in your juice, your water. You can have tea with your honey. You can have tea with the power water soluble. You can combine those two. Or again, we have the pure, which is the broad spectrum product as well. Let's see if I want to add anything to that. I think that's all I want to add. There is an announcement that I have to make. And that announcement is from our CEO. And let me see if I can share that with you quickly. I'm going to stop sharing my screen for a second, and I'm going to find her email here. And let's see if I can share this. And it's our Valentine special. And we're going to give this to you. I'm so excited that I can share it. So can you see that?
Yes.
Wonderful. So our Valentine Day pack includes these products, and these products include the gummies, the CBD G-Spot Lube, the shave oil, the CBD body butter, both of them, and the soft and sensual aftershave. This product is retail at $214.70, and your price is $149.95 with CV of 95. So that's our Valentine's Day pack that includes all of these products that you see on the screen for $149.95. The CEO just told me that this pack is on the website as I am presenting. So that is, again, the gummies, the King of the Jungle gummies. Both men and women can use that. The CBD lube, both men and women can use that. The shave oil, of course, women have to shave as well. And then our CBD body butters and the aftershave balm. So I'm going to stop sharing my screen right now, and we are going to take questions from the audience. I'm not sure if we have a flyer for Friday night, but absolutely Friday night, you are going to want to tune in to the real sizzle, Friday night with Dr. Joy Smith and Kathy Weathersby. But
we do have a flyer.
Dr. Rita,
great.
yeah, we have one. I was going to say, if Kathy's on her
it.
computer, she can share it. I've never shared from my phone. But
Yeah, I'm on the computer. I'll get it while you answer those questions, Dr. Rita.
Okay, wonderful. Let's see. Ooh, there's so many comments. Oh, great. I love this question. Dr. Rita, please address the importance of sexual health for women without partners. Really important. Really, really important. Sexual health for women and men without partners, right? And so, you know, sexual health is just as important as your heart, as your kidneys, as your lungs. You know, being able to give yourself pleasure, if that's what needs to happen, is important. So our products are there to do just that. The G-Spot Lube is a great product that can be used for women without partners, as well as all of the other products that we offer at Wakana to help to reduce anxiety and to bring pleasure and to improve blood flow. Again, when we talk about any sexual dysfunction, there's an underlying pathology that we have to look at, you know, and the underlying pathology in a lot of the sexual dysfunction is decrease in blood flow, inflammation. There can be sexual anxiety. There can be arterial blockage. There could be high sugar levels. There could be constriction in the vessels because there's hypertension. And that's why it's imperative that when you look at addressing sexual dysfunction or overall wellness, in a holistic, organic way, you have to include diet. You have to include exercise. You have to include water intake. You have to include CBD, and you have to be consistent with it. If you're on medications, you have to be consistent with your medications, right? Because if you're hypertensive and you decide to stop taking your medication, then your hypertension is going to not get better, and that can cause issues with sexual dysfunction, issues with libido, issues with erectile dysfunction. So lifestyle modification, along with working with your physician, working with the CBD products, and working with them consistently. Not, oh my God, I haven't taken my CBD in a week. No, the CBD needs to be taken twice a day under the tongue, gummies at night, your honey, the new honey products, in your tea, in your water. All of these products need to be taken every day. Why? To reduce the inflammation, to improve blood flow, to become an opportunity for the blood vessels that potentially could have plaque, reduction in plaque that comes with a diet that is free from processed food, fried food, you know, foods that are not high in cholesterol. All of these things work together. So let me get back on point to answer your question, Francine. It's very important for women to obtain pleasure even if they don't have a partner. It's important for men to obtain pleasure even if they don't have a partner. It's very, very imperative for sexual health to be just as balanced as your heart health, your kidney health, your liver health, your dental health, all of that, your eye health. It's all very important. And the endocannabinoid system absolutely addresses all of that. You know, the endocannabinoid system, when you consume CBD, puts all of that in balance because we need all of those systems to be working effectively. Yes, the products will be available individually on Friday. Great question. Yeah, wasn't that a great question? That was a really great question. Somebody's going to have to help me with all these questions because it seems like, I don't know if there's a lot of questions or a lot of comments.
Did you see the question about for the lube, what happens if by accident it gets in someone's mouth?
Oh, it's fine. It's edible. It's a cherry bliss flavor. It's edible. It doesn't matter. You know, as a gynecologist, I wouldn't recommend you shooting that lube in your vagina because you just don't know how the vaginal mucosa may respond. So you always, whenever you're dealing with a topical product, you always want to use a little bit, and you always want to use it on the outside of the vagina, the vulvar area, the clitoris area. I mean, it's really meant for lubrication, and it's meant to help to improve and to heighten the stimulation of an orgasm. So placing it on the clitoris, on the outside of the vagina, the vulvar area is a great way to start. I wouldn't take this lube and start, you know, gouging it in the vagina.
But it
But it's
is
okay if it's already, you can, yeah, it's edible.
Okay, alrighty. Did you see the one wants to know if the person can take CBD products during knee surgery next week?
I would recommend that you refrain from CBD about 48 hours before your knee surgery. And then then resume afterwards. So you can speak with your physician if it's laparoscopic, you know, what type of surgery, how long it is, how extensive it is. But typically in those long surgeries, you don't want something that could potentially cause some excessive bleeding.
Alrighty. Julie would like to have some questions addressed in another platform. So would you mind giving out your email address, please?
Yeah, my email is Rita, RITA MD at wakana.com. RitaMD at wakana.com. You're going to put that in the chat for me. Thank
Uh-oh.
you so much.
Spelling, typing too fast. I misspelled it. So, how about that?
So there's questions about the coffee. Let's take some questions about these products first, and then you can email me about other products.
Right.
RitaMD at wakana.com.
Someone asked about the products being available individually. Dr. Rita did read the answer, but they will be available on Friday on the website. Is the G-Spot lube equivalent to the one already on the website?
Yes, it is. It's equivalent to the one that's already on the website. Yes.
Are there any sexual health pure products for people who have random drug screens?
So all the products that are used topically, you can use if you have random drug screens. Obviously, the honey, which you are ingesting, and the gummies, you would not be able to use those because they have 0.3% or less of THC. Those are full spectrum power products. But all of the topicals ones you can, yes. And you never know, try a little honey down there.
People have already bought the pack. They're putting it into the chat already. There are 162 people here to listen to you, Dr. Rita, talk about this. So obviously sexual health is important.
Oh,
And
sexual health is so important. And it's something that physicians just don't like to address. They don't like to talk to their patients about sexual health. And it's really important, right? And we all know as healthcare providers that when our patients are dealing with chronic illnesses like hypertension, diabetes, obesity, many of them have sexual dysfunction just because of the pathophysiology of the disease that causes hypertension and diabetes. The inflammation, the reduction in blood flow, the constriction of the vessels. So it's something that you have to talk about with your physician. And if you don't feel comfortable talking to your physician about it, you may want to think about finding a physician you feel comfortable talking about that with, because sexual health is very important, right? Sexual health can cause a buildup of anxiety, and that can cause an imbalance, not homeostasis in your body. So we want to make sure that we offer you here at Wakana holistic, organic options of addressing your health. Viagra and a lot of those medications, yeah, they're used, but they have pretty serious side effects that you have to think about. And, why not choose a holistic, organic option to address your health with very little side effects? But again, you've got to remember these products should not be just taken 30 minutes before. Let's get
Dr.
these
Rita,
products in your system. Yes.
you got a question that can you use the G-spot on the penis?
Yeah, you can. But the G-spot is meant for the G-spot. It's really a product that's really helping to help to stimulate and enhance the clitoral area, the vaginal dryness, but absolutely can be used on the penis. Absolutely.
Can the lack of blood flow to be the cause of male menopause? Can the lack of blood flow be a cause of male menopause? That's the question.
Yes. Right. So male menopause is also more of a hormone issue. And we know that CBD regulates and modulates the hormone imbalances. So that's why I'm really stressing that you're using these products along with the tinctures, along with your gummies, along with the smokables, along with all of the products that we offer here. And what happens when you have that CBD in a steady state in your bloodstream, that when you are now ready and in the mood, they're going to be a lot more effective because you've got a reduction of inflammation. You have better blood flow. You have less anxiety, because anxiety can ruin everything, right? Anxiety is real. So we want to make sure that the body is in homeostasis as much as it can be, even before the sexual encounter.
So would you replace the regular gummies with the King of the Jungle for daily use?
You could, you absolutely could, but you wanna you wanna you wanna have your wellness package, and your wellness package would be your tinctures, topicals if you need, your gummy at night, and you want to use the King of the Jungle gummies at least an hour before your sexual encounter. So I wouldn't replace them, but what I am saying is that you want to make sure, and I don't want you to get confused, you want to make sure that you are using the CBD products as recommended, your tincture twice a day, your gummies at night. Why? Because you want to make sure that you are reducing inflammation, improving blood flow, and adding on our love is in the air products during those sexual encounters. The love is in the air products are going to enhance the sexual encounter. They're going to improve the sexual encounter. They're going to give you more stamina. They're going to give you more energy. But again, it will be much more effective if you continue to use your CBD regimen as recommended from all of our talks that we've had. Did that answer your question?
I think so. That was the question in the box, so they're saying yes.
Okay, great. Because the King of the Jungle CBD gummies are 150 milligrams of CBD. So for wellness, no one needs that much, but for the stamina, energy, and that libido, you're going to need that. So you don't want to replace it. You want to add that to your regimen.
Someone wants to know, should we be tracking the total amount of CBD per day?
I would. By tracking, you can see exactly what works for you. I always believe in having my patients and my family, my customers journal. Absolutely. You should always be journaling so you can see what works for you. So tracking or journaling is key. So yes, 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 and yes.
Wow. Lala says, and I double, wow, wow. This has been great, Dr. Rita.
Ah, Minister Mooney is saying something about the King of the Jungle. Wonderful. So that package again is on the website. The price is $149.95. Get great saving. Retail is $214.70. It's 95 CV. Again, you want to make sure that you purchase that package. You get that in the hands of all of your loved ones, all of those who are over the age of 21. And we are going to share the flyer for Friday, because Friday is all the sizzle. It's all of the after hours on how you use this product, right? I was giving you more of the science. I was trying to make an impression. Hopefully I've made an impression on you.
A big impression.
Sexual dysfunction is not something you're just going to throw at someone, a little gummy, right? We need to really help these people improve the blood flow, reduce the inflammation. And so we're going to do that with all of these products. We're going to really continue to keep our wellness products on board and use these as enhancers and really exciting products for the bedroom.
Dr. Rita, there is one more. Someone is asking if the pack will last all month or longer. Do you know
Depends
that?
on how active you are.
How,
So if you're
how,
very
how often are you going to use it?
right, that's right.
Mhm.
So you are really
Hey.
active, it's not going to last long. But
I
if
I think
you
they mean
are
all month on the website with the pack. I think that's what they
oh
mean.
No, Dr. Rita. I don't think so. I don't think so. I
no,
think
I
they
don't think
mean
so. I think they mean how long
Oh,
it's
all
gonna
month?
last.
Okay.
Yeah.
they can speak for themselves. So
I love it. I love it.
So
So excited.
well, any other comments from the medical advisory board? Any other comments about erectile dysfunction or sexual dysfunction or
I just
sexual
think
anxiety?
what kind of has knocked it out the park again, because a lot of those ingredients inside of our products complement the CBD, because CBD is going to decrease that inflammation, and so does some of that. What's the ingredient? Panax ginseng,
Yeah, panic ginseng.
henbane, and it's just amazing. I'm so excited. We get to have these open conversations, and we're also looking to bring our health back into balance at the same time. So just great, just great. And the
Yeah.
nerd in me is so excited to learn about all the ingredients. So
Yeah. And I just think as healthcare professionals, we're very passionate about really helping people to understand that you can change the trajectory of your health by using these products along with diet modifications and exercise and all of those things. And that's exciting that we can offer these products and educate those who have these sexual dysfunction that, there is help. There is a way that you can change your health and your wellness. So we
and
can
not
do
have to
that.
use Viagra to change that sexual desire, because we
Right.
know it can interact with so many other medications.
Absolutely. Absolutely. Excited.
Me
Any other
too. This is
Excited.
questions?
awesome.
If
Rita. Thank
not,
you. Thank you.
Doc- Dr. Joy, we already have somebody mentioning something for the playlist. Marvin Gaye. Let's get it on. I think that's what they said. Yep, let's get it on. We
Yes.
we definitely have that on the list.
Teddy Pendergrass.
We,
Oh, yes. Turn off the
yeah,
light.
yeah. She is so
Sexual
good.
healing.
That's
Really
right.
great.
Uh-huh. Keep it coming. Keep it coming. Oh yeah,
Wonderful.
Erica, that's right. See, I was gonna throw in some Prince too, but Prince, you gotta walk that line a little bit. You gotta pick and choose your stuff. Yeah, yeah, that's another good one, Lala. I forgot about that one. That's an older one. Yeah, well, actually, not as old as Adore.
Is the passcode all caps?
It is. The
It's
passcode is if you're gonna use that,
all caps.
if you're going to use that ID number, it is. Uh-oh, I took my caps
Is
off.
it all caps?
yes.
Okay. Dr.
It is.
Sylvester is all caps. Wonderful. Well, thank you, everyone. We're going to end it for tonight so I can deliver some COVID babies because people were busy. So we're busy upstairs. I'm going to see everyone Friday and have a great night. And thank you so much for joining. Oh,
Thanks, Dr. Rita.
if you're a guest on the line, please connect with the person that invited you because they're going to send you to their website. You can get these products ordered and we can have just an amazing time on Friday as well. So good night, everyone. Thank you for joining. We'll see you later.
Bye. What a night. What a night.